everybody. Welcome back to Reclaim You. Laura is here today, and we're going to be talking all about perimenopause and the many, many things that can come along with that.
Yes, many.
Many,
Mhm.
many. Let's start by sharing about your book that you read.
So this book was actually recommended to me by a number of people, but it's by Heather Corina. What fresh hell is this?
Mm,
Corina. I'm not sure how to say their last name, so I apologize, Heather. But basically looking at perimenopause, menopause, and just what it means to be a person who has, the organs of ovaries and a uterus and all of that stuff, and what it means to begin to age and move into a different part of life. So, but they're really funny. They talk about their own experiences, but they also offer a lot of good data, and so it's a really good mix. It keeps you reading and interested, and I guess just I felt less alone. Yeah.
I've been seeing a lot on Instagram. I don't know why the algorithm has me here about perimenopause content lately, but the algorithm's got me. So I've been watching it a lot. So it's interesting that we're recording this after seeing some more talk than I think I've ever maybe seen before about perimenopause.
Maybe your phone's just really listening.
It's listening. It's listening. Like,
Mhm.
ooh, what are all
Yeah.
these hormonal shifts happening?
Yeah. Yep. Exactly.
Yeah.
Yeah.
What fresh
Yeah.
hell is this? That's a perfect title.
What fresh hell is this? Yeah, they really chose a great title. I appreciate it. Yeah, so that's a really great resource out there, and we'll talk about resources a little later. But I mean, certainly that's one that will give you a really full overview. And it also looks at the history of women's health and like why it is that this isn't something we talk about, some of the injustice. So they do a really good job of exploring that as well.
Let's talk a little bit about, to start, like, what is perimenopause? Because we hear about menopause. I don't know if a lot does not quantify it. No, we hear about menopause sometimes, more so than perimenopause. So let's start there. Like, what is it?
Sure. Yeah. So perimenopause is basically this transitional period, right? That's leading up to menopause. Menopause, the definition of that is that you've gone 12 or more months without a period, right? But perimenopause is this period of time of transition until that point, and it can range in terms of how long it lasts. I mean, some women it might be a few years, other women it can be decades. So it varies so widely and isn't really widely studied. It's becoming more studied, I think, over time. But typically the duration would be 4 to 10 years, and the onset would be somewhere in your 40s, though there are some women who can go into an early perimenopause transition in their 30s, some rarer that in their 50s might start the process. And that's all assuming that you haven't had any type of surgery or aren't on any type of medications or maybe having chemo that could impact that process. So to just be mindful that there are ways in which the perimenopause process can be trumped by other things that are going on, especially like a hysterectomy and things like that are going to take you right to menopause.
Yeah.
Mhm.
Yeah.
Yeah.
So what happens during perimenopause?
Yeah, so I think it was Heather who talked about in the book. Basically, it's reverse puberty, but sort of not, right? But
Mhm.
but
Mhm.
but like puberty, is that one of those times of life that we remember fondly?
Oh, yeah, right? Like, no.
Do we all just look back and just love that, especially those of us who had to deal with the onset of our periods and what that meant? And no, like basically at that point, you're going from low hormone levels and then your hormones are all over the place. And anyone who's had, especially like a teenager in their home who's going through this could tell you some things. And so what happens here is that now the hormones are beginning, they start to vacillate, they're sort of all over the place. And basically your body is beginning to move toward not having a regular cycle anymore, right? Like your reproductive stage of life, if you will, is moving toward the end of it. Though you still can get pregnant in perimenopause. So it's important to talk to your doctor about, what that means and how you need to tend to that. But yeah, so basically there's 3 hormones that are most involved: estrogen, progesterone, and the follicle stimulating hormone. So the fluctuations of those in your body lead to a lot of things like not least of which is menstrual cycle irregularity, which some people might start to notice some shifts. Some of us were never regular. Some of us are on birth control, so it's not always obvious. But you also are going to see physical, emotional, mental health changes. So it's basically, it was really interesting to read like the receptors for some of these hormones are like throughout our whole body. So our entire system, our entire body is impacted by this stage of life, by perimenopause and menopause. So yeah, you're going to see a lot of changes, and we'll get into the specifics of that.
Yeah. No, that does feel so important, especially when we're talking about mental health and how perimenopause can impact mental health, right? The physical health and mental health aspects really go together.
Oh, yeah, you can't separate them from each other. And I think there's this, lately, because my algorithm as well is tuned into this, there's been a lot of memes floating around and other things, like the typical woman who's in perimenopause or menopause. And there's this particular like image we have of that person who's just emotions all over the place, like is just snapping at you, is like sweating and on fire. And while, yeah, there's truth to all of that, some of that portrayal of this stage of life also has stigmatized it in a way where like women don't want to talk about it. They don't want to be perceived in any way as emotionally volatile or which is legit. Your hormones are all over the place, and it's not that you can't control it. It's that your body is shifting and changing and you're feeling the effects of that. So we kid around about it as women, and I think that's okay. But when society as a whole has some things to say about it that stigmatize it, we just need to be mindful of that.
Yeah. And I do think that people talk about it. Of course, people joke about it in the teenage years, like the angsty years, right? But it's kind of like more permission is given or more grace is given for teens going through that stage of life where the hormones are coming in really hot than folks who are older and are experiencing a very similar process. Like you said, the reversal of the process. Not as much grace is given for what actually is going on.
No, and you have the underlying issues too of just like women in general. Like if women are in some respects or historically have been portrayed as, their utility in society is to bear children, which is problematic for other reasons, which we don't need to get into. But now this is a huge part of what it means to be in the body, that is a female body. Now that stage, that period of time when you can bear children is over. So, what does that mean about who you are? And there's a lot of like women just sort of, we get to a certain age and society sort of just pushes us aside. We're silenced, right? Like, and yet women at this age and older have so much wisdom and just so much, some folks kid around. It's like the I don't give a fuck period of life, right? I'm not going to be held down by the bullshit that held me down for, the first half of my life. Now I have these freedoms potentially. Let me live into them, but we are up against some societal things still. And that's sad. And part of that is just not knowing a lot about perimenopause, which is why we're here today.
Yeah. Yeah, sure. I'm just thinking about how for folks who have experienced trauma and maybe complex trauma and how the body holds so much of that. I think our practice in particular sees a lot of people at midlife coming into the practice looking to do some healing work. And I haven't ever thought about this before, but maybe there's some connection of like experiencing some of this upheaval on top of the dysregulation that's inherent from trauma. Like, oh my gosh, I need to figure this out. I need to do healing work. Understanding the workings of their body just a little bit more deeply. Just, I don't know, feels like a little connection that just came into my mind.
Absolutely. Yeah. And we can touch upon that a little bit more as we get into like the symptoms, but for sure, like already existing conditions, particularly mental health conditions, medical conditions, but already existing conditions or like unhealed parts of us certainly can be further exacerbated by this period of life.
Would this feel like an okay time to talk about more of the symptoms of what's, the deep dive into everything that shifts and changes and shows up?
Yeah, let's do it. Yeah. I think there's the things that like we mostly hear about, one being hot flashes, right? Like it's the typical, like at a certain age, women are just like having their moments. And this is the vasomotor symptoms, right? So hot flashes, night sweats, chills, and basically statistics show that 75 to 80% of women in perimenopause actually experience these symptoms. And things like hot flashes can also like kick off or be started by like other things like heart palpitations, panic attacks, like hopelessness and dread. So there's an impact mentally as well. Or just think about it. Like I have a hot flash in the middle of a public place. I'm sweating profusely everywhere, right? And I'm like red as can be. And like there's just a certain way we might feel. So, and then there's night sweats. I've started to experience these from time to time, and they're not pleasant, right? They disturb your sleep. You wake up and you're like soaked, and you're like, do I have a fever? Like, what's going on? And it took me like a couple nights of this to be like, maybe this is not, I'm not sick. Like this is something else going on. So yeah, like taking like just being mindful of that, like layers, have a fan, cooling sheets and pillows and stuff like that. Heather does a good job of like giving a lot of information related to like ways that you can tend to yourself and help yourself during all of these aspects of perimenopause. So yeah, that's the area that I think we talk about a lot.
The hot flashes for sure.
And I think the one that, you know, as you were alluding to earlier, the psychological and emotional changes, right? This is like you're having all these hormonal fluctuations, right? Our bodies are going through these fluctuations on a daily basis or within the day. So we might find that anxiety, depression are increased. We might be more irritable. There's mood swings where we're having trouble regulating our emotions because of what's going on. And then like if we're not getting adequate sleep already because of some of the other changes going on, that can further exacerbate these symptoms and vice versa. So it's definitely like a whole lot of things that we might find are worsening, if you will, or exacerbated. And there's a 2020 study that talked about how women, particularly in early menopause, have a higher risk for depressive symptoms. So just something to be mindful of. Also, as you alluded to, if we have PTSD, eating disorder, or if like there's any trauma, even if we haven't been diagnosed officially or formally, those things as well could be exacerbated by what's going on. I mean, think about it, your body's going to go through some major changes, which we'll get into. That certainly is going to impact body image, could impact ED symptoms. And, you know, if you have a history of trauma and now like things are happening in your body that are changing it, it could bring up some memories that are embodied memories that then lead us into having to do some of that trauma work around it. So, I mean, we talked about the societal stigma. I mean, that's certainly like having to address that with everything going on, like depending on the support we have, depending on like our stress levels, you know, we could see increased things like addiction, suicidality at times. So like looking at that, like your stress level as well is so important to consider because stress increases, cortisol increases, inflammation increases, right? Like all of that stuff happening isn't helping us at all. So stress management is one of those things, which is easier said than done.
Easier said than done.
Right. Yeah. And for me, I think too, like grief, right? Like literally the grief about changes that are happening physically, emotionally, all that stuff. But I think, you know, who am I now that I no longer bear children? Or for some of us, we never had children for various reasons. Some of that might be by choice, but some of it might not have been. And so there can be things that come up around that that are unique to the individual's lived experience. And, you know, I think about, I didn't have kids for various reasons, and there has been grief that I've been having to tend to in my own person related to like, it's really over now. Like the odds every year, you know, once I turned a certain age, it was like every year you just feel like, okay, I'm getting closer and closer. And there can be a lot of pressure at the end of our childbearing years to like try and get pregnant, which can also lead to a lot of stressors in our lives. So there could be a lot to work on with a therapist.
Yeah, that's for sure.
For sure.
That's filled with grief all over the place. Yeah.
So yeah, I think that's like, you know, it's also like you're not young anymore.
Right.
And I think that really hit me personally recently in the past few years where I was like, always. I spent a good portion of my career working in a college environment. So that kept me young, I think, in a lot of ways. When I worked in the church, I kind of had all years that I was dealing with, but it's recently I've really started to feel my age, like not being as aware of things that are going on, just feeling like, I don't know, like I never thought I would be that person to be like, you know, just completely throwing shade at, ways that younger people are acting. And I find that I'm becoming that person. Like, am I now going to be that woman? But there's good reason for it. Part of it is just lived experience and wisdom.
Yeah,
And
absolutely.
part of it is irritability. So I think that all of that to say that, like, this is an aging process. And so also looking at, like, what changes come about as we age, what abilities start to be compromised as we age. Like, this is sort of the precipice of all of this in a lot of ways.
Yeah. And what beliefs do we have about aging, right? Like,
Indeed.
what meaning of aging do we make for ourselves too?
Yes. Yeah. And do we encounter in the world at large? Right. A good friend of mine and a colleague had let her hair go gray. And at the time she was in her 40s, like probably mid 40s, and she let her hair go completely gray and she looked fabulous, right? Like, and she's got this amazing personality, so much charisma. And then I noticed at a function that we were at, like a year later, she had dyed her hair again. And so I asked her about it and she said, people just didn't see me.
Wow.
I was treated differently. I wasn't, she said, people, and she's like, I walk into a room and you notice me, but when my hair was gray, I was treated differently and I was noticed far less.
Wow.
Yeah. So dyeing her hair became a way to be seen again.
Yeah. Wow.
Yeah. So those are important things for us to just be mindful of. And you're not, like, some people are like, am I crazy? Like, what's going on? Like, some of my clients and friends of mine, it's like, no, there's like legit stuff happening here, both like individually to the person, but also in the greater world that's impacting you. It's okay to feel this way. Let's talk about it. I think, like, also looking at cognitive changes as well, right? Like, hormonal changes, definitely people talk about brain fog, like forgetting things. I mean, I forget things often anyway. I was undiagnosed ADHD for most of my life, but these things can be, like, those of us who are neurodivergent, that can be exacerbated by this stage. Just forgetfulness. I lose things, I misplace things more than usual. So, that sort of comes up as well. And that can lead to further stress. And, it's just sort of all of this, like, it's all connected and
it's all connected.
Feeds into each other. And yeah, exactly.
And just knowing, though, like knowing that all of these symptoms we've talked about, and you're going to continue to talk about, that they're normal, I think it helps you feel a little less like othered and like there's something wrong with you, right? These are all natural processes that are happening in our bodies and might just inform the way that we care for ourselves in terms of like self-talk and stepping outside of shame and all of those types of things that we talk about on the podcast.
Yes. Yeah, for sure. The most important aspect of caring for ourselves is to put ourselves first in the midst of this and really be aware and seek the support that you need. And we'll get into that at the end. But yeah, part of that is self-talk, and how we've seen ourselves till this point might shift dramatically. And that might be an amazing thing.
It might be. And it might be filled with grief, right? Everyone's process is going to be so different. Yeah.
Yeah, that's the thing, is there's no this happens to everyone and this doesn't happen. It's just so individualized. And that, I think, is what can be difficult, because we can feel alone, but we're not. And we need to talk about it more. We need to, as women, just bring this into the light and encourage this to just be a natural part of conversation, just like anything else.
Yeah. So if you're listening to this, the Instagram algorithm might get you.
Yes, it might.
Which might be really helpful in normalizing. So here's hoping.
I hope so. Other symptoms, if that's helpful, certainly sleep disturbances. I think I mentioned that before. Anything else going on can impact your sleep, but your sleep in general might be disturbed because of what's happening hormonally. Studies show insomnia and restless sleep affect up to 60% of perimenopausal. So that's a significant portion of us that are going to experience some sort of sleep disturbance. And so there might be things that you need to do to tend to that. And we mentioned some of that before, but also some women choose to, like, just sleep by themselves, or some people, I should say, because not all people going through perimenopause identify as female or as woman, but some choose to, if they have a partner, sleep separately from the partner, or like for them, but also for their partner, because it can be so disruptive. So just things to think about. Yeah. So, like, that's all going on. And so, like, in general, if any of these things happen in a given week at any age, it would kind of like throw us off our game. And now this is all happening, and sort of feeding into one another. And pain too is a big part of this. And I don't know that we talk about this as much, but our estrogen levels are declining. And there is this correlation between that and increased musculoskeletal pain. Add to that stress related to life and or just I'm in perimenopause, that can further exacerbate the pain that you're feeling, right? The cortisol, the inflammation. I think that the other half of that, though, is that there are some things that might decrease in pain. So, like if you were a person who had really challenging periods where you had a lot of cramps, or, things like that, you might experience that now less because you're having them less often. So some of that might be decreasing. Some of the things that came up in like my readings and in articles and stuff that I was looking at, like things like restless leg syndrome, many women experience low back, spine pain, migraines and tension headaches, increased allergies and sinus pain, dizziness, vertigo. And then you can also have the vulvovaginal and uterine pain as well with what's happening. So like, basically what we're saying here is like your whole body could be in pain.
Your whole body is doing these weird things.
Yes.
Of course you're having pain.
Yeah, exactly. Like, yeah, your whole body is experiencing this hormonal fluctuation that it goes on for quite a while. And so, yeah, like pain is a part of that. And so sometimes that's tough, right? Because we're having pain, we go to the doctor. And what happens often is if the doctors are not aware or informed, they don't think about perimenopause. They don't think to be like, maybe this is perimenopausal. Instead, you wind up getting all these tests and all these other things going on.
Right.
And you feel like you're crazy because they're like, well, nothing's wrong with you. You're fine. And here it might just be that this is perimenopause. Yeah. So just to consider that before you're like, going down WebMD to the depths of, I must have some sort of terrible thing happening with me. Let's remember this might just be natural hormonal changes and the impact of them on the body.
Yeah. And mention it to your doctor if they're not mentioning it to you.
Exactly. Yeah. Yeah. Definitely. Definitely. And there's nothing wrong in like pursuing with your doctor's advice, like testing for other things. I mean, your history, your doctor knows your history. But yeah, to consider this as part of that equation. Yeah, I think, digestive issues as well go along with that. Like just in general, like, yeah, you're going to have digestive issues. You're going to have changes to things like, it used to really be easy when I was sexually aroused to be lubricated, to get wet, if you will. And now I'm experiencing vaginal dryness, burning, irritation, and that has an effect on my sex life, my arousal. I might have increased pain because of these things, whether it's on the daily or when I'm having sex. There can be increased infections or imbalances, UTIs, yeast infections, things like that. And then the other thing too is urinary urgence, right? Or incontinence, right? Like this is where like those ads for poise pads like become relevant, especially women who've had children. Anecdotally have told me, yeah, that's like an issue. But yeah, like I wake up now many times during the night. I used to maybe get up once during the night. Now I'm up at least twice. There's just an urgency that might not have been there before. Now you want to get checked for UTI and things like that, sure. But part of this, again, is just these changes are happening.
There's a sleep disturbance too, right? Like on top of everything else, there's more sleep disturbance.
Exactly. And think about too, like if that's starting to happen, like just to go out in public and to be like, my gosh, like what's going on with my bladder, which is why now we have things like poise pads and like they have the period underwear, but they also have the pee underwear, right? So like, I don't know that we give enough credit to like, these are all more things I need to consider in my everyday life, right?
Yeah. And how to prepare for, and make sure you have what you need.
Yeah. And have anxiety about.
Yeah.
And so and again, as we're listing all these symptoms, it's not to say that everyone has all of these symptoms. They don't. Some people have pretty easy perimenopause. Other people, it's really hard. Some people are in the middle. So, to not freak out that this is the, end of everything that you've known. No, but just keep in mind that there are going to be these shifts. And I think that brings us to body changes, right? So the body at large is changing. We've covered some of the specifics, but your size, your weight might change. And to think about it, like your primary estrogen source until this time has been your female reproductive system, right? And now that is turning off, if you will. And your primary storage of estrogen is coming from fat. So the body naturally is going to start to store fat. It's going to redistribute fat, especially in the stomach area. And there's this great quote that I found in Heather's book by Dr. Margot Main, who said, your belly fat is not your spare tire. It's your life preserver. So this is like a body's natural way to start to prepare for aging. And as you age, having a little bit more fat on you can be helpful if you're facing some significant health issues. It can be helpful if you fall, right? Like there's ways in which they can be helpful. So to think about, all these changes are happening in our body. My metabolism is changing. All this stuff is happening. Yet, in a way, your body is just naturally moving into a new state. It has a lot of wisdom. The same work we do with trusting our bodies when it comes to ED stuff is the same work we do here. How do we trust our bodies?
Yeah.
How do we stay attuned to our bodies? How do we have neutrality around our bodies? How do we not get sucked into diet culture, which is just as present here as it was when we were younger?
Yeah.
So those are things, to keep in mind, like your nails, your hair, your facial hair now, right? Like we're carrying tweezers all the time. If we had PCOS before, we might know what that's like. But yeah, the body is changing dramatically.
And the research shows that the most common times for folks to experience an eating disorder is, adolescence and then again at midlife, which makes a lot of sense with all of these changes that are happening in the body, to the body, and how we start to feel really uncomfortable in our own bodies because it's like a whole new landscape.
Yeah, for real. And this is where we see, like, our society, I think it's just getting progressively more normal for people to engage in things like plastic surgery or other types of ways to tend to their bodies. I think we used to see it more at this age and probably still do, but I'm seeing it in younger and younger people who are having procedures and we have these places people can go to get all these different treatments, and so it's easy to get swept up in that.
Sure is. Yeah, it sure is.
In your social circle, in society, again, this is where that work, and if you've done that work before, it's calling upon skills you already have in place.
It might call you to get back into a similar type of work in this season of your life, to take it maybe a step deeper.
Yeah, indeed. I think it's a really good time to step into, like, ooh, this is a major transition point. What does this mean? Not just on not just on the day to day, but what does this mean in terms of my life, in terms of my path, my identity? Yeah, for sure. Yeah, I think the only other thing related to like the body and symptoms, like obviously this goes hand in hand with everything else going on. Sex and sexuality can change, right? Like fluctuations in desire, it can go up, go down, it can go all over the place. And then like also just changes in the physical and emotional experiences of sex. If sex is painful, that shifts the experience, right?
Yeah.
So some things to keep in mind.
Anything else that you feel like we should mention about challenges around this period of time?
Yeah, we talked a little bit about like the taboos around aging and menopause, and I think keeping that in mind. There was a 2020 survey that was published in Women's Midlife Health, and it showed that 70% of women felt uncomfortable discussing menopause due to societal stigma.
Wow, that's significant.
There's an historical marginalization of women's health issues, right? We know that there's research more and more that is showing that, and this affects the way we talk about these things. And there's also like how this affects us interpersonally in the workplace. Think about like now I'm going to work and I'm going through this period of time where, without me knowing it, one moment I can be totally fine. And the next moment I'm going through a hot flash, or the next moment I'm having, some mood dysregulation. And so there's some people who feel really challenged at work, especially like they're going to be seen differently. And ageism in the workplace, this is where, and it's real. And this is where this can come into play. So yeah, there's other challenges that go along with it as well.
Yeah. So, what are some tips on how folks can care for themselves if they're maybe thinking, oh, I might be having some perimenopausal symptoms, or maybe they're like, oh shit, I definitely am having some perimenopausal symptoms.
Yeah.
How
What is happening?
Like what? Yeah, you're describing my experience to a T. What can people do to kind of care for themselves through it?
I mean, it really, I think, is putting yourself first, right? And first in that is finding healthcare providers that you trust and you feel safe with, right? I think we don't say enough about how important that is. There are still so many places in the healthcare system where people feel unsafe, unheard, unseen. And so, making sure that the providers with whom you're working are people you feel comfortable with, you feel safe with, and you can get recommendations from others that who are having those experiences, talk to other people. But there was a study in 2021 that talked about how over 50% of women feel that their healthcare providers are not adequately trained in menopause management. So,
Yeah.
yeah, that's
Mm-hmm.
significant. Maybe you're going to a GYN, who has more experience and more understanding, but like your primary care physician needs to know what the heck's going on,
Yeah.
right?
Yeah.
Other physicians need to understand the intersection of this with other things going on in your life.
Yes.
So, yeah, I mean, feeling safe, feeling heard, feeling like you have physicians or providers who are competent, who understand. So I think that for sure. So that's one aspect of support, right? And the other aspect of support is you can find support through therapy.
Mm-hmm.
You can find support. There's support groups out there. There's one like big support group that's called the Red Hot Mamas support group,
Oh,
right? That comes up in a lot of places. It's
oh,
for
that's good.
perimenopause, menopause support.
Huh.
Yeah, there's also a lot of social media groups out there, like Facebook groups, other groups out there that there's meetups, and sometimes like local facilities, like maybe it's a OBGYN office or maybe a hospital might have some sort of support group around this or like a series. So really in your area, checking out what's going on or talking to your doctor. Do you know of anything?
Mm-hmm.
Calling your OBGYN. But I think too, like for me, a really easy, well, a potentially easy one, depending on the women in your life, let me say this, or the people in your life, is talking to trusted others who have been through this, right? Like this is where their wisdom especially can be amazing. I'm really fortunate to have a lot of women in my life who are more like my mother's age, and these are things that I can talk with them about and they can be open with me, especially because my mom's not here.
Mm-hmm.
My mom's deceased, and my mom went through early menopause
Mm-hmm.
because she had surgery. So, yeah, just those trusted women in your life, whether they're your age or older, who can just like be there for you and commiserate with you at times, laugh with you, support you. This is where I think the people we surround ourselves with really matters.
Yeah.
Yeah.
Yeah. Yeah. So you feel less alone.
Yeah, for sure, for
Mm-hmm.
sure. Another aspect of support that, came to mind was like finding a good intuitive eating dietitian to work with.
Mm-hmm.
And the reason for that, again, we talked about earlier, because some of these symptoms can be exacerbated. There's all of these things out there about changing your diet, and
Yeah.
doctors will say, oh, diet, lose weight, right? It's the same old at this age that it was at every other age.
Yeah.
So having a provider who can really support you in listening to your body and learning to trust your body. And I believe intuitive eating dietitians are really great at that.
Absolutely. Yeah. They can help you
Yeah.
find the nuance in all of it. Right.
Yeah, for
Mm-hmm.
sure, for sure.
Mm-hmm.
So yeah, like just having this like network of support, utilizing it, availing yourself of the information that's out there, becoming informed yourself, whether it's, the book that we talked about, there's tons of podcasts now, there's other things out there that are available. So just reading up on it as you can, or listening to a podcast might help you to feel a little more connected and a little less alone.
Mm-hmm.
And then overall, it's just like taking care of yourself, right?
Mm-hmm.
Like
Yeah.
managing your stress. And this is where things like, mindfulness, meditation, yoga, this is also a stage of life where we talk about joyful movement and eating disorder recovery. Joyful movement here
Yeah.
too, right? And we're not talking like you don't have to go out and run a marathon. But what are things you do to keep your body moving? And what are the things that you can do as well to keep yourself healthy? Like something as simple as staying hydrated. But a big one that comes up in a lot of places that I've been reading is to quit smoking if you smoke, because that just exacerbates everything. So, you might need to avail yourself of some smoking cessation support as well, if that's the case. Those are some ideas for how to care for yourself. And, I think the other part of this that I want to mention as well is if you have a partner, to be able to talk to your partner about what's going on in a way that is open and understanding. This might impact your relationship to a degree where you might need some outside help. Maybe you need to see a couples therapist, get some support that way, or meet with your pastor or something like that, right? But it could test aspects of the relationship. This is also a time when many couples who have had children find that the children are leaving the home. So there's a shift as well. And I
Yeah.
always say, this is a really great time to think about maybe we could use help sitting with someone else who can, help us to understand and communicate better with one another. But, we need our partner's support, but also like our partner needs our support too.
Yeah.
So utilizing what's available to you there as well, I think is really important.
Yeah. Well,
Mhm.
this feels so helpful. I think that people will feel really seen and informed. And like we said, something that isn't discussed enough. If it was, then we probably wouldn't be recording this episode.
Yeah. 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 Indeed. Indeed. Yes. 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 Yeah. And it's coming up a lot. I think I know women that I see now, my caseload often is women who are of this age range,
Mhm.
but it's coming up more and more. And as a therapist, it's something that I've had to be like, wait a minute. I need to consider this as part of what's going on in their lives as well.
Yeah.
That, maybe the trigger here, some embodied trauma from the
Mhm.
past because of perimenopause, and we're looking for something else that it isn't, right?
Right. And we're just like piling dysregulation on dysregulation that's already there.
Yeah.
Yeah.
Yeah. So,
Mhm.
yeah, any that type of, emotional regulation, I think at any age is helpful. So, those
Yes.
practices of nervous system regulation, and there's tons of resources out there as well. And you can work with a really great therapist who can walk you through that too. And we're here.
And we're here. Yeah.
Yeah.
Well, thank you so much for sharing all of this. And
Mhm.
we'll be sure to link the book in the show notes so
Mhm.
that folks can check that out. It has a really lovely cover.
Mhm.
Pulled it up again for you too.
Oh, yeah. What fresh hell is this?
I love it. Flames.
Whee! Yep. It's funny too. The little like bullet points are little flames too.
Oh, that's hysterical. Oh, I love it.
Yeah. Yeah.
Perfect.
Yeah.
Well, thank you again. And we'll be back next week, everybody. So we'll talk to you then.